The COVID-19 pandemic has had a significant negative impact on our mental health. We are still living with the pandemic. The mental health challenges are still bothering us, and it should be identified and taken care of in the early stage. Mental health includes our emotional health, psychological health, and social well-being. People who are emotionally healthy are in control of their thoughts, feelings, and behaviors. They can keep problems in perspective and bounce back from setbacks. They feel good about themselves and have good relationships. Despite the prevalence of mental or emotional health challenges, the stigma of mental illness can prevent people from reaching out and getting the help they need, even from their own families. Dismantling the stigma around mental health is more important now than ever. However, fighting the stigma is not an easy or a quick battle. The only feasible stigma-free way for people to take care of their emotional health challenges selectively in the early stages without delay is to use an online platform anonymously to reduce stress and improve their emotional health. Therefore, we have created an app, DopaDrive. We have already published the app at the Apple App Store and Google Play Store. On this app, there are two types of users, namely, DopaDriver and DopaRider. Everybody can sign up as an anonymous DopaDriver to take care of their emotional health challenges. DopaDrivers are encouraged to use pseudonyms and avatars to hide their identities. A DopaDriver, however, needs a DopaRider. The DopaDriver plays the role of a patient in talk therapy, while the DopaRider plays the role of a therapist. In our daily life, visiting a talk therapist automatically labels us with a mental illness in our mind even before the therapist gives a diagnosis, which plays into the hands of mental illness stigma. Because therapists handle all kinds of mental health issues. This app focuses only on emotional health part of mental health. On this app, an anonymous DopaDriver would pick up a DopaRider on demand. Unlike therapists who load patients with unconscious mental burden by diagnosis, DopaRiders do not provide any diagnosis or any recommendation or even any judgmental comment to DopaDrivers. DopaRider only quietly listen to DopaDrivers' stories to let them release their mental pressure or organize their minds or get energized by talking about their success. Thus, after talking to DopaRiders, DopaDrivers are free from any shadow of mental burden that usually felt after talking to a therapist. DopaRiders can also provide other services such as brushing up the faded memory of a job-related skill, job-related advice, advice for a trip from their own experience, and even telling new jokes. DopaDrivers would feel relaxed without any mental health labels and come back for more. DopaRiders are not required to have any professional training in psychology. Anybody with a good listening ability can be a DopaRider. But DopaRiders are required to successfully complete a short training course about the code of conduct and take its test before being active as DopaRiders on the platform. DopaDrivers and DopaRiders interact virtually online. The DopaDrivers compensate the DopaRiders for their service. We charge a commission fee of 20% for each payment to DopaRiders. On DopaDrive, the DopaDrivers are not only stigma-free, but they can also screen and connect with their like-minded DopaRiders who share their values and can understand their stories. DopaDriver can screen their like-minded DopaRiders using Tinder-like mechanism, connect using LinkedIn-like system, and hang out with connections online or in person based on the group they belong. All these features are available for freemium subscriptions with limited access or premium subscriptions with full access. Now, we need your investment for advertisement of DopaDrive on social media to reach out to more users and grow our platform. Please invest in this new mental health paradigm to grow with us.